exhausted, overworked and putting themselves at risk every day to protect us. These are our frontline healthcare workers, and with 447 COVID cases currently in New South Wales hospitals, along with outbreaks across Sydney, their work has never been more important.
John Townsend treated some of the first COVID patients in Australia. Since the pandemic began, the 33-year-old nurse has worked in multiple emergency departments across Sydney's southwest and on the front line of critical respiratory care.
Witnessing an intubation of somebody who's in severe respiratory distress, that's quite traumatic for the individual. It's quite difficult and traumatic for the clinicians because someone's struggling for every single breath, and really it's something that nobody wants to have to go through at all.
Also an SES volunteer, John is no stranger to a disaster. He was sent to treat the injured in the Black Summer bushfires. But he knows the battle to beat Delta is by far his hardest job yet.
What is it like inside our hospitals right now?
We're all exhausted. I can see it in the faces of my colleagues. I can see it, often with my patients. No one person is, shouldering all of this. We're all part of a healthcare team across the entire state.
John has so far avoided catching the virus, but like many of his colleagues, he's been exposed and forced into isolation.
At any time where I've had to go off work for any sort of risk like that, the guilt that you feel for not being at work, helping your colleagues out, is just something I wasn't expecting.
Are you scared of getting COVID?
The things that go through your mind are understandably quite difficult. You're wondering, is that little niggle at the back of my throat just my mind playing tricks on me, or is it something that I could be experiencing? Could I have COVID-19?
His shifts are long and they never finish on time.
When people are finding it difficult just to wear a simple face mask over their mouth and nose, you have to think of the staff who are seeing you are wearing a full N95 mask. They're wearing hair nets, they're wearing basically an entire plastic suit over them as part of the PPE. We're sweating for 8 to 12 hours at a time, and it's near unbearable.
Then there are the unknowns.
The problem is with this disease, we don't know fully what the long-term effects are going to be. What's going to be happening in the next 20 or 30 years as a result of the COVID pandemic is completely unknown to us.
By the time a COVID-positive patient arrives at hospital, they are seriously ill. The care they need requires a team of doctors and nurses. As case numbers remain stubborn in their hundreds here in New South Wales, the pressure on our health staff is mounting every day. Are you worried about what will happen if beds run out?
It certainly is something that's concerning if we do run out of bed capacity, and I think that's something that just needs to be in the forefront of everybody's mind.
At the Royal Prince Alfred, a staff member has tested positive. At nearby Canterbury Hospital, 2 wards have been shut after 7 patients and a staff member tested positive. On the cancer ward at St George Hospital, 4 patients and 2 staff have the Delta strain, but another 21 patients are waiting for their test results. 8 patients at Liverpool Hospital in the city's southwest have died as that cluster grows to 37. While an outbreak in Nepean Hospital and the adjoining mental health centre has infected 38 staff and patients. All up, health bosses say 1,000 workers across the city's hospital network have been forced to isolate.
We really are in the most critical situation that we've faced throughout the pandemic.
Dr Danielle McMullen from the Australian Medical Association.
It's really worrying to see COVID cases in non-COVID wards. Other wards and the emergency department are just like the community, and we're unfortunately seeing cases of COVID in those wards in patients who either may have mild symptoms or no symptoms and are then picked up, which really poses a risk to the other people around them.
As John heads back to the hospital for night shift, he's begging us all to stay home, for his sake and ours too.
The pandemic is real, the virus is real, but if you wanted to help us at the moment and help us beat this thing, the best thing you can do is stay at home. You could sit on the couch and basically help us save the world.